I'm here with Dr. Marion Shuler Holiday. We're going to be showing a dog examination.
All right, this is Rimley. He is our volunteer, and Tim was just taking our temperature. We start every exam with a weight and a temperature, and then I come in and I do my exam, and I'll kind of talk a little bit about what I'm looking for. So this is Rimley. He's a good boy. He is a 2-year-old male neutered lab retriever. And so I first start by looking at his eyes. I'm looking at the conjunctiva just to make sure nothing is red. Make sure his eyes are brighter and alert. I don't see any defects in them, sicknesses, no drainage. I look at his teeth, and his gum color is good. I check for gum color, and you can see he's got a little bit of tartar starting in the back. So I'm going to talk to his owner about dental health and having dental cleanings done. I feel his lymph nodes here. All right, let's look at your tongue and the back of your throat. That looks good. Okay, lymph nodes look good. Look in his ears. And I even give a smell test. You know, you need to use all of your senses when you're doing a physical exam. And his ears look great. These dogs tend to get ear infections a lot. His look good. So then I feel more lymph nodes, and if I feel an enlarged lymph node, that can mean anything from an illness to cancer, and so I want to make sure that I check everything on the outside that can give me any sort of clue about what's going on the inside. Let's feel this lymph node here. There we go. And then I usually ask owners too about, have you noticed any lameness, and I check out his feet, I check out his nails, all of his joints. And then I kind of run my hands along their body, feeling for any sort of lumps and bumps, any sort of injuries. And we come to the back end here. And I feel the belly. So a big dog like this, I'm not going to feel every organ, but I'm basically looking to see, is there anything that sticks out that's abnormal? And I don't feel anything abnormal on him. Go back and feel the hind end, and a lot of times the big dogs like this, I do a little bit of an orthopedic exam. I just want to look at range of motion, and do I feel any crunchy crepitus from arthritis, and I don't in him, fortunately, since he's a 2-year-old dog. So that's really good range of motion in your hips there, buddy.
Have you ever done that and had a dog yelp indicating pain or when you're feeling a dog all over?
Absolutely. I will have dogs some dogs I can't get beyond about right here before they yelp. And so that is definitely a sign of some hip discomfort, hip pain. They may not be limping, but they could have poor range of motion due to arthritis. And then we check your skin. Make sure we don't see any fleas or any skin infections going on here. So you can see he's got nice white skin. If he were an allergic dog, his skin might be bright pink. And that's kind of something we look for. And we look at the belly for any sort of lesions. I don't see anything on him. That looks good. Okay, and so the next thing that I always do is listen to the heart and listen to the lungs. And that is as internal as we can get on a physical exam. So. And while I listen to his heart, I'm also feeling a pulse here, too. Good boy. Good boy. Okay. And Julia's holding his mouth closed for me so he doesn't pant, because then I won't be able to hear anything.
Why is his tail wagging?
This side. His heart sounds great. I don't hear any murmurs. I don't hear any arrhythmias. His lung sounds are nice and clear. And so I always make sure to tell that to the dog owner so that they know everything that I've listened to and looked for. And that's a pretty general orthopedic exam sometimes, physical exam. Sometimes I will go into more of an orthopedic exam if a client tells me they've had problems with their dog limping. Sometimes I'll do a neurological exam if I find anything abnormal on the physical exam that leads me to that.
Well, thank you, Dr. Shuler Holiday.
Absolutely, no problem. Thank you, Rimley, for being a good boy. Good job, buddy.